Welcome to this tutorial video. This video introduces the domain Health of the Indigenous Navigator's Climate Change module. In this video, we introduce the concepts covered in this domain and the relevant human rights instruments. Climate change and climate change-related measures can impact multiple aspects of Indigenous peoples' right to health, including leading to foreseeable or actual harms to physical or mental health of Indigenous peoples, and impacting traditional healing and medicinal practices. Climate change and climate change-related measures can change health conditions in Indigenous communities. For example, flooding, leading to increases in waterborne diseases, or increases in disease spread by mosquitoes, or having impacts on mental health, such as depression and stress. Climate change can also affect traditional healing practices. It can affect the availability of medicinal plants or their effectiveness, impacting traditional healing practices and medicines of Indigenous peoples. Indigenous peoples' right to health includes the fundamental right to health, as well as the right to maintain traditional medicines and health practices. Article 24 of the UN Declaration on the Rights of Indigenous Peoples says, Indigenous peoples have the right to their traditional medicines and to maintain their health practices, including the conservation of their vital medicinal plants, animals, and materials. Indigenous individuals also have the right to access, without any discrimination, to all social and health services. Indigenous individuals have an equal right to the enjoyment of the highest attainable standard of physical and mental health. States shall take the necessary steps with a view to achieving progressively the full realization of this right. The right to health is in legally binding human rights standards, including Article 12 of the International Covenant on Economic, Social and Cultural Rights. Additionally, the Committee on Economic, Social and Cultural Rights in General Comment 14 clarified that one of the key elements of the right to health is that health services must be respectful of the culture of communities. And in particular, in relation to Indigenous peoples, states must protect Indigenous peoples' medicinal plants, animals, and minerals. Based on this, the National Survey assesses whether national policies considered climate change-related impacts on Indigenous peoples' specific rights to maintain traditional health practices, as well as the general right to an adequate standard of health. The community survey then aims to collect community experiences on whether availability and accessibility of traditional health practices has changed due to climate change, and whether there has been an increase in certain illnesses which are linked to changing climate conditions.